So what exactly is STYE? The STYE is a acute bacterial infection which can affect your upper or lower lid, and it is generally present along the eyelid margin. The eyelid margin has got glands, sweat and sebaceous glands, and these glands can get blocked and their secretions as a result cannot come out. This results in an increased risk of infection, and generally it is the Staphylococcus bacteria which has been implicated as the cause of STYE. So who all are at risk of developing STYE? Patients who already have eye conditions such as anterior blepharitis, seborrheic dermatitis, diabetes, increased blood lipid levels are at a high risk. Also, patients who have a constant history of eye rubbing are at an increased risk of developing this STYE, as they can transfer the bacteria from their hands directly towards the eyes by rubbing it continuously. What are the symptoms that are generally seen with STYE? In an earlier stage, there will be no swelling. However, there is pain which is felt around the eyelid margin, and there might be some tenderness in that region along with some eye irritation. Later on, there will be the development of a swelling which initially is small, it is tender, and it can appear angry red in color. Over a period of time, a pus point may even develop in this swelling. Now let us discuss some treatment options that you can do at home. While STYE can be a very irritating condition and a very painful condition, certain things that you can do at home which will help to reduce the duration of the STYE as well as the size of the STYE. Warm compresses are your best friend. Now, how do you do warm compresses? Warm compresses are done by heating some water, putting a piece of cloth in it, squeezing out the excess water, and dabbing it over your eyes. This can be done several times a day and should be done for at least 5 to 10 minutes. What it does is that it heats up the area, provides relief from the pain, and allows for better drainage from these glands. Another thing that you can do is that you can use eyelid scrubs, which are basically mild shampoos. What they do is that they remove the debris from that area and also provide a clean area which promotes drainage from these glands. Also, the contents that are there in these shampoos break down the bacterial membrane, and this helps to reduce the load of the bacteria. An important thing to note is that never squeeze or pop your STYE, as this can result in the spreading of infection. While there are several over-the-counter antibiotic ointments which are available in the form of azithromycin or erythromycin ointment, which can be used to reduce the duration of the disease and the severity of the disease, it is always recommended that you visit your eye doctor before buying anything from the pharmacy. Finally, let us discuss, are there any ways to prevent a STYE? Yes, there are. The first and foremost thing is good eyelid hygiene. This can be done by using mild shampoos such as baby shampoos to clean your eyelashes every week. The second important thing is avoid rubbing your eyes or touching your eyes continuously. This will reduce the chances of bacteria getting transferred to your eyelashes and reduce the risk of STYE. The third most important thing is avoid sleeping with eye makeup on, even if you are tired. Also, in my experience, patients who have a tendency for developing STYEs have a undiagnosed refractive error or are not wearing their spectacles, as a result of which they experience eye strain, which increases the tendency to massage the area around the eyes. This increases the risk of bacterial transfer to the eyelid region. If you found this video to be useful, please press the like button and subscribe to the channel for more such informative content, and you can even click on the bell icon which will notify you about a new video once it gets posted. And I will see you all again very soon in the next video. Bye bye.